welcome to my drug awareness presentation. So, what are drugs? Drugs are chemicals and substances that affect both your mind and your body. The prolonged use of drugs may lead to physical and or psychological dependence. An overdose of any drug may lead to death. Why do teens try drugs? Like this, to relieve stress, to feel cool, to celebrate, or just boredom. Risk factors. Friends who use drugs, absence of healthy recreational or leisure interests, early antisocial behavior, parental drug use, academic failure, favorable attitude towards drugs, prenatal exposure to alcohol, family management problems. What are the types of drugs? The stimulants. They speed up the brain and central nervous system. Depressants. To slow down the brain and central nervous system. The hallucinogens. These drugs alter the user's states of consciousness, distort auditory and visual sensations. The examples of stimulants are caffeine, nicotine, cocaine, and pills. The examples of depressants: alcohol, heroin, marijuana, sleeping pills. The examples of hallucinogens: LSD, ecstasy, magic mushrooms, or PCP. First, the alcohol. It's a central nervous system depressant. Alcohol goes directly from your digestive system into your bloodstream, and within minutes it spreads in the entire body. The brain hits with the highest concentration because it gets more blood than any other parts of the body. In low doses cause relaxing effects, concentration, impaired concentration, slow reflexes. In medium doses, it causes slurred speech, drowsiness, and altered emotions. In high doses, it causes vomiting, breathing difficulties, unconsciousness, coma, and death. The alcohol effects on body. Here's the brain of a normal person on letter A, the brain of a person with Alzheimer on letter B, and the letter C, the brain of person with alcoholism. See, it's like dehydrated. So next is the nicotine and tobacco. The tobacco contains a chemical called nicotine. Tobacco is also contains more than 19 known chemicals that can cause cancer. As a group, these are called tar. So here is the consequences of tobacco. It causes death, of course. Uh, there are more than 7,000 chemicals and compounds in cigarette smoke, many which are toxic, can go into your lungs. It can cause early cardiovascular disease, smaller lungs that don't function, wheezing that can lead to a diagnosis, and DNA damage that can cause cancer almost anywhere on the body. The marijuana. It's a brown mix of dried flowers, stem seeds, and leaves from the hemp plant Cannabis sativa. Its effects are short-term effects. Here are the short-term effects. As you can see, when you first used it, it feels good, right? But in the long-term effects, it may cause breathing problems and defects, and can cause cancer. The bath salts, stimulant typically in a white or brown crystalline powder that contains more chemicals that are physically similar to amphetamine and MDMA. There are tons of risks if you use this, including the meth, the heroin, the cocaine, the ecstasy, the LSD, the drugs, the steroids. These are the consequences of drug use on children. Drug abuse is preventable and drug addiction is a treatable disease. Brains from addicts are different from the brains of people who are not addicted. Effective treatment programs typically incorporate many components, each directed to a particular aspect of the illness and its consequences. Addiction treatment must help the individual to stop using drugs, maintain a drug-free lifestyle, and achieve productive functioning in the family, at work, and in society. Because addiction is typically a chronic disease, people cannot simply stop using drugs for a few days and be cured. Most patients require a long-term or repeated episodes of care to achieve the ultimate goal of sustained abstinence and recovery of their lives. It's not worth the risk. Do not use drugs. That's all. Thank you very much.